Good morning, grade nines. Today we're going to be looking at chapter 8. We're going to start chapter 8, and which is all about social programs. In this video, we'll be looking at uh, what social programs are, and we'll be looking at what kind of social programs are in Canada provides to its citizens, but also comparing Canada's social programs to the United States. So let's get started. Social programs. So the big thing to realize and the necessary thing to realize with regards to social programs is it all has to do with improving the quality of life of people in Canada. So quality of life is the general well-being of individuals and societies. It looks at negative and positive features of life, and it observes how satisfied people are. So basically, the way I sum up quality of life is just basically how good people's life is. It is the government's job to ensure that Canadians have the highest quality of life they can possibly have. And it's in their job to improve on people's quality of life. A government is not doing its job if quality of life is not good, because if the quality of life is not good, or people find that their quality of life isn't could be improved on, it's the government's job to figure out how to do that. A large part of how we measure quality of life, or how people's quality of life is improved, is through this idea of social programs. And so, what social programs are services provided by the government to reduce economic inequalities and to promote the well being of citizens. So, some examples of social programs are welfare, employment insurance, healthcare, seniors benefits, education, and public housing and shelter. So these are just a few of the social kinds of social programs that our government provides us. So um, the big thing to know is, yes, we do know that a lot of people, the government provides a lot of social programs, but the big thing with that is, how do governments provide them? How do they pay for them? How can they afford them? And the big thing is we pay through it. We pay through it through our taxes. So the thing to remember is, the more social programs you have, the more in depth and the more they cover, the more expensive they're going to be. So the higher taxes are going to be. And just because taxes are high does not mean it's necessarily a negative thing. It just means that they'll be paying more taxes. So we're going to look at that here in a little bit. So the big question, though, with regard to social programming is, should we do it through public means, i.e., should the government fund it, or should we look at private industry to provide these social programs for us? So this is the debate. And when we look at Canada, we look at the United States, we see that our two countries have gone in very different directions. Although we both do have government funded social programs. So in Canada, different levels of government provide and fund different social programs. So, what I mean by that is, our federal government provides some funding for various social programs, and then our provincial governments provide social programs, as well as local and municipal governments as well. So, an example of this is, the federal government provides the Canadian Health Act, which basically gives us uh, public health care. And then the federal government outlines and provides money to the provinces about what for their health care, but they also give the provinces rules they have to follow when providing health care. So the provinces are responsible for providing the service. However, they have to follow the rules of the federal government, and this happens with a number of other social programs as well. So, like I said before, our federal government has provided us with a piece of legislation that dictates what our healthcare system has to look like, and dictates that it has to be a public healthcare system. So and this is called the Canadian Health Act. So the Canadian Health Act is federal law that sets out 5 principles for healthcare in Canada. Um, it says it is rules that every province must follow in order to get the money to pay for their healthcare. So the 5 rules is, they must be public. administered, which means they must be run by the government and it cannot be for profit. Is our healthcare system is not meant to make a profit. It is meant to provide services to its citizens, and all money that is charged to people or through taxes or through services must be used to pay for the healthcare. It is not meant for the government to make money. It has to be comprehensive, which means that it has to pay for hospital visits, it has to pay for doctor visits and surgeries, meaning it has to be comprehensive, it has to cover all health services that people access. It has to be universal, i.e., available to everyone in Canada. Um, and that leads us to the next rule, which is it has to be portable. Meaning, if you are an Albertan and are visiting Ontario and you need to visit a doctor, it has to be covered, regardless of where you are in Canada. And finally, it must be accessible. So people must be able to get the services with fairly close to where they live and in a timely manner. It is important to note, though, when I say a timely manner, is that for some services in healthcare, you're going to be waiting longer because they aren't deemed life threatening. So if your life is in danger, you have to be able to get, i.e., have your life saved by doctors if it needs be. However, if you need to get, say, a hip replacement or knee surgery or something that will make your life better, but it's not life threatening, you might have to wait longer. So for some of these surgeries, such as hip replacements and knee surgeries, you're waiting a year, up to a year or two, in order to have these surgeries, and that is because we only have so many surgeons, we only have so many operating rooms, and the priority is given to life-saving surgeries. So these principles apply to services provided by hospitals and physicians and surgeons. However, one thing that is not included in this is dental care and eye care. So we still have to pay for our own eye care and our own dental care. So this is important, and i.e., dentistry is getting dental care is very expensive. So this is one of these things, and this is one of these things that maybe we can improve on in the future. Um, so this is a chart of basically what we spend on healthcare. And it's not necessarily the one thing I did want you guys to look at is both these lines are this is provincial spending and this is federal. And one of the things is important to note that um, so the provincial government provides most of the money for healthcare. However, they do get a substantial amount of money from the federal government as well. And if you look at healthcare spending, and this is what this chart shows is as from when we look at from 1995 to 2003, the healthcare spending is going up, and this continues to go up to this day. So on the flip side of that is we have the USA, who with regards to their healthcare system and their social services, they do not provide as much as Canada. In fact, a lot of them are actually private programs and therefore profit industries. So individual states can make their own laws and are only subject to the American Constitution with regards to their social services. However, uh, it all depends on what the states want to offer with regards to social programming. For example, states such as Massachusetts, with regards to education, offers much higher levels of education and more funding to education than states such as Tennessee or Alabama. Although some services are provided, they are not always the best in the United States. Although the federal government has passed the Social Security Act providing health care to the poor, the quality of this service is not as good as, say, the private health care in the United States. So once again, though, we can see that American U.S. Spending on healthcare is increasing as well, just like in Canada. However, it becomes a debate with regards to healthcare, with regards to Canada and the United States, and this is the debate between private and public healthcare. So, what private healthcare is healthcare is paid for by the individual. Is any service you access with regards to your health, you have to pay for out of pocket. To battle the increasingly expensive costs, though, what many people in the United States can do is they can buy what is called health insurance. So it is an agreement between individuals and an insurance company that they will pay a certain amount of money every month in order to protect themselves from the high cost of healthcare. So say you'll pay a couple $100 every month, and when you finally need to access healthcare, the insurance company will pay the bill. So the idea is, so for example, you'll pay a couple $100 a month, but if you need surgery in the United States, which can cost upwards of hundreds of thousands of dollars, your surgery will be covered by the insurance companies. But it is important to note that these insurance companies are not out to just provide a service; they are out to make a profit. So there are some downsides to this. So it is in the best interest of the insurance company to make sure that they only have to pay them out the minimal amount because they want to make a profit. So any they're hoping that the amount of money people pay them for insurance is going to be more than the amount they pay out. Whereas in Canada, we have a public healthcare system, which is our services are paid for by our taxes and it is paid for by the government, meaning that when people in Canada go to a hospital, they go to a doctor, we don't have to pay for anything. May have to pay for medication, but we do not have to pay for the services. So an example of this is, let's use in the example and look at the difference between, say, having a child. So in the private, when you have a child in the United States, you have to pay for your hospital visit, you have to pay for the doctor, you have to pay for staying in the hospital and delivering a child in a hospital. If you have health insurance, you can pay you can use your health insurance to have a child. So you might get, say, a day or two in the hospital through the health insurance. Your health insurance will pay for a doctor for you to deliver the child and so on. If you don't have health insurance, you have to pay for that out of pocket, and that can be very costly. Whereas in a public healthcare system, what happens is you go to when you are having a child, you go to the hospital, you have the child, you see the doctors, and it is all paid for by taxes, and it is all paid for by our healthcare system. Um, it is important to note, though, one of the trade-offs with this is within our public system, our taxes are substantially higher because we have healthcare. Whereas in the United States, where they have private healthcare, taxes might not be as high. Um, so once again, the goal of private healthcare is to make money. So it is to make money, not necessarily just to provide a service. So what I want to close off with this lesson for is to look at the some different social programs that are provided in the United States and Canada. So we'll look at Canada first. So we're going to look at three different kinds of social programs in Canada. And sort of how it is provided. So in Canada, we have three kinds of social programs we have healthcare, we have pensions for senior citizens. A pension is basically money you get after a certain age. Um, a certain age to help you survive when you get older and allow you to retire. And then income assistance, so unemployment insurance, or in the United States they call it welfare. So, what is provided for healthcare? So, what is provided in Canada is all citizens receive basic healthcare from a system paid for by taxes. The federal government and provincial governments fund the healthcare systems and pay for the healthcare system through our taxes. So, it is administered through the Canadian Health Act. which you can see we looked at a little earlier, and you can see on page 274 of your textbook. And each province decides what services are paid for by the taxes. And the legislation that enacts it, like I said, is the Canadian Health. So for pensions, what is provided at the age of 60, I believe it's actually 67 now, all citizens of Canada who have lived in Canada for the least 10 years automatically qualify for a monthly pension paid for by taxes. So it's important to know that this pension it's not allowed people to live. It just gives people a little bit extra money. It is provided by the federal government funds, which provides the pensions. So the federal government, um, every every month on my paycheck, I pay into the Canadian pension plan, which means that when I retire, I will be able to access this Canadian pension plan. And the legislation that is provided is called the Old Age Security Act, which is the federal legislation. And then finally, we have what is called income assistance. So what it is provided is, in general, citizens who are unable to meet their basic needs for food, clothing, and shelter receive income assistance paid for by all of the taxes we pay. The eligibility for this, or how people are able to access this, varies through each province, but it is provided in each province. So, how is it provided? The federal government gives money for this through its social programs, and each province gets to set out the criteria for who is eligible for it. And once again, the legislation is each province has different legislation. So these are three different kinds of social programs that are provided in Canada. Um, and how sort of we pay for them. Once again, we pay for all these things through our taxes. So the United States, once again, has these same sort of similar programs, but they are different. So what is provided? So in the United States, citizens with low income receives health care paid for by taxes. So this is called Medicaid. It is notoriously underfunded in the United States, and it's not necessarily the best medical system. Is because doctors who work for the private system in the United States, so for private hospitals, um, I do make more money and they're higher paid. Um, but all other and but there is a Medicaid system for those who are sort of the lowest income earners in the United States. All other citizens pay for health insurance personally. We talked about health insurance. Um, but it's also important to note that about 15% of people in the United States in 2007 did not even have health insurance, meaning that when they got sick, when they had to go to the hospital, they had to pay the full amount, which can equate up to hundreds of thousands of dollars. So how is Medicaid provided though in the United States? Is the federal government funds and provides all the Medicaid system. It is done through taxes and it is done through the Social Security Act. So pensions for citizens, there is no government provided pension for senior citizens. So senior citizens in the United States are generally generally required to support themselves through their own personal savings and private pension plans through their jobs and stuff like that. So if you did not put money aside, or you did not work for a company that provided a pension, you are basically out of luck, and it is your own responsibility. So if you can't afford to live off what you've saved, you cannot retire. You have to keep on working. So once again, there is no pension system for senior citizens in the United States. And finally, income assistance. So, in general, citizens unable to meet their basic needs in the United States are given assistance, and they refer to it as welfare in the United States, and it is paid for by people's taxes. The federal and state governments fund income assistance at both levels of government, and both levels of government are set out the criteria for who gets this. So this is once again through that Social Security Act, but also each state also has their own legislation. So I'm not going to get you guys to do this assignment, but this will help you with the first few sections on that chapter 8 booklet. So I hope if you have any questions, please reach out. I hope you enjoyed the video and learned a lot.